Hi, I'm Randy Alvarez. You're watching the Randy Alvarez Marketing Report. Today's topic, the 10 reasons dentists don't get or sell the cases they want. With us, we have one of the biggest names in consulting and dentistry, Dr. James McAnally. Dr. McAnally, welcome to the program. I'll call you James?
Yeah, absolutely.
Okay, good. Now, for people that don't know you, and we should mention, before I met you, I was a big fan of yours. And I remember reading your book about 4 or 5 years ago, saying, this guy gets it, as far as from the selling process. Yeah. So you were a dentist, so tell me your story, how you got involved in helping other dentists.
Classic child of a dentist, grandfather, father, all dentists. So the profession's treated my family very well. I followed in their footsteps, became a dentist. Classic overachiever, at the top, nearly the top of my class, Phi Beta Kappa in college. Great dental residency, into practice right away when I was very young, in practice at the age of 25. And like many dentists, you build up a general practice, and at some point you find that things are a little bit boring. So I started pursuing a lot of advanced education, which is very common. You get a lot of these guys on your show as well who have a lot of training. Yeah. And after 4 or 5 years of really learning how to do some pretty complex things, in my case, dental implants and particularly surgeries, I found that I wasn't getting cases. I was still kind of bored in my practice with the general dental side of things, and yet I had all these skills and I wasn't getting cases. And I had a bit of an epiphany. It's like, well, I've either got to go out and find how to fix this problem, and that is to go be able to find the patients with marketing, and also how to sell to these patients, or I should really not be taking these classes.
Okay.
And so that was the epiphany for me.
So you wanted to learn how to sell.
Exactly. We're not taught that as dentists. It's not really in our personality types. But yet, in order to really do the best possible service to the public, you have to be able to sell your services. And ultimately, that wound up with me arriving at a destination where I did figure out how to market for my practice, find great cases, and find ways to sell that were ethical and that I could teach to other people. And ultimately, just by sort of random chance, a lab that I was using that also provides something called a digital preview service, where you take a photograph of the patient and then they do a simulation or a preview that you can show the patient. He started noticing that I was doing a lot of cases.
Okay.
And basically one day he rang me up and he's like, James, what are you charging for these cases? How do you get them? And ultimately that led to him saying, you need to take this to the profession. And so sort of this random interaction with sort of a vendor that I was working with, next thing you know, I was like, okay, well, great, I'm going to do that. So that's kind of how I wound up getting into doing consulting.
I met a client of yours. There was a dentist, and he was in my green room, and he gave me your book. He said, he goes, this guy has changed my practice, like doubled his income. Is that typical that people get like some big changes in their practice?
Yeah, absolutely. The guys that, the guys that have the skills. These are the people that have gone.
So they're good at what they do as far as
they've gone to John Kois, they've gone to Dawson Pankey, they've gone to Mish Implants, they've gone to LVI, they've gone to Pack Live. You name these great programs. Those are the ones that they have the ability to do the kind of cases that can double their profit in the practice. Okay. While working less hours. But they have to have certain other things besides just the skill sets to make that happen.
So you teach them to become more effective.
Exactly.
Okay. Now your book, The Dentist's Unfair Advantage, I read your first book. I skimmed through this one. Yeah. I made one of the people that work here read it. She didn't look too happy when she was done. She loved it. So what is this book about?
Well, ultimately, after having my hands in hundreds of practices in the last 8 years, actually our sales training has been taught to several thousand dentists worldwide. Okay. I've noticed sort of the key characteristics of things that when they're present in a practice, it really makes a big difference with doing more fee-for-service dentistry, doing the cases they want. And so basically I took those key characteristics, or tenets as I call them, and decided let's write about it, let's put it in a book that could go to the whole profession. Okay, good. Now how do people hire you? Ultimately they come to our website, a phone call's made, they look at what we're doing, we usually have a personal conversation, and then they make a decision. Well, either I'm going to up my game with selling my services, or I want some help with training in how to do advertising, or I just want a custom solution. And as you know, a number of our custom solution clients wind up ultimately on your show because it's one mechanism of helping them find patients.